Any health-related information on the following show provides general information only. Content presented on any show, by any host, or by any guest should not be substituted for a doctor's advice. Always consult your physician before you begin any new diet, exercise, or training program. And thank you for listening to the Whole Care Network.
Welcome to Healing Ties on the Whole Care Network. On Healing Ties, we're creating a life to love after caregiving ends by sharing stories and resources and being with awesome people like you. Now that caregiving has ended, let the Healing Ties begin. Here's your host, Chris McClellan, the Bow Tie Guy.
Well, greetings everyone. It is Chris McClellan, the Bow Tie Guy, for another special episode of Healing Ties. And actually, this is a super duper special episode because we are celebrating Love a Senior Day in Pueblo, Colorado. And that is the hardest city for me to pronounce in the entire world. So I know my good friend Carol Chirito will be kind of proud of me that I was able to get it on the first try. But I'll let Carol and our special guest be the judge of that. Certainly want to send a hello and a shout out to all of our friends and listeners in the UK on ukhealthradio.com. We appreciate your continued support of the show. And you know, if you have a topic for any of our Healing Ties podcasts, just send me an email at wecare@wholecarenetwork.com. Again, that's we, care, C-A-R-E, we care at wholecarenetwork.com. And today, on this podcast, we are celebrating, like I mentioned just a few seconds ago, Love a Senior Day in Pueblo. And my special guest today is Dr. Dave Baer, who is a dental surgeon. Well, I'm going to have to say that word again. Pueblo Dental Surgery Center. And Dr. Baer studied dentistry at the University of Colorado and obtained a teaching fellow at Ohio State University. So, Dr. Baer, welcome to the show.
Hey, how are you doing today?
Am I doing okay? We're pronouncing Pueblo.
Yeah, you're doing pretty good. Yeah, just Pueblo. It's a great town. So
it's always been a tongue twister for me. So, and I've always had fun with Carol when she gets me talking too fast, and I really get the vowels all mixed up. But good.
Sure.
It's great to visit with you, and looking forward to the Love a Senior Day this Saturday. But before we get going on a little bit of our conversation today, why don't you let our listeners know a little bit more about your background? I'm sure I didn't do it enough justice here in my introduction, but I'm sure the listeners would love to hear a little bit more about you and what you're doing to help seniors out in Colorado.
Sure. It's fantastic. So I was born and raised here in Colorado. I did some college out of state and then university study, and then came back for dental school here in University of Colorado, did my dental school there. And then I went out to Ohio State and did 1 year just teaching fellowship, a little over a year, something. We're in the Department of Oral Surgery. And so at this point, you know, I primarily focused on simply helping people out with dental needs, dental anxiety, just basically trying to help people get back to where they want to be, able to chew, able to, you know, eat healthier things, broccoli, get things in their diet that maybe they haven't been able to eat for a while, remove painful or teeth which they may or may not be embarrassed about or have pain with, or whatever the needs are. In dental school, I published a few articles with, I guess, my mentor, and published some articles on bone grafting and dental implants, things like that. And we just ended up putting together this dental surgery center here in Pueblo, where we have it really nice. We work with a lot of dentist anesthesiologists and myself, who I have my anesthesia sedation privileges as well as dental anesthesiologists, but it's really nice to be able to work with two anesthesia providers oftentimes when we're treating patients. But yeah, so we basically get together and try to see patients and help patients. There's so many that have either had a rough dental experience or whatever it is. I mean, shoot, even a good dental experience isn't usually fun.
You said that right. Goodness, but there's been so many. I would have been so many advances in dental care over the years with technology. But you said a word that really hit home: dental anxiety. I think that we all know that we need dental care, but there is that anxiety that we all have when we come into the dentist.
Well, and it's very understandable. It almost spirals us out of control. We get nervous about something, and then we prolong or put something off that we might need to get done, and then it gets worse, and we're in more pain, and then we want to do it even less. And it's totally. I mean, I actually understand it, because I understand that it doesn't make sense, but we all do it. We all do these things with lots of things like that in our life. And so getting behind that anxiety, what's wonderful is I've actually seen in my treatment history, I've had some patients who are just terrified of seeing the dentist. And when you walk in the room and they're on the ceiling, and and I totally understand that. The beautiful thing is, with sedation dentistry, we can actually kind of retrain and rewire some of that anxiety. I've seen several patients where the first time we sedate them, it does take a good amount of the medications going in their IV to get them comfortable before we can even work. And then what's amazing and wonderful is there's one gal, I remember the second time she came in, we did a similar procedure as the first time, maybe even a little bit more. And we ended up using probably less than a quarter of the medicines we used the first time we saw her. Mm-hmm. And then she came in a third time, and literally compared to the first day we saw her and treated her to the third time we treated her, we used less than 1/10 of the medications that we originally gave through her IV.
I get it.
To sedate her and accomplish, because she came in and she left, she got home, and she didn't have all that built up fear and anxiety. And I'm not talking about, we do have nitrous, and that's just laughing gas. That's good. It's nice. But generally, if people are really nervous, it doesn't nearly cut it. So we end up usually doing IV sedation, where we start a little IV in the arm or the hand. And then even, there's plenty of children we actually give not laughing gas, but a mask to, where they actually go to sleep with the mask, and they don't even remember getting an IV started. So at young ages, we help to prevent them from developing this anxiety that I'd say so few of us don't have. I'd say most people have at least some to a lot of dental anxiety. And it really does make these procedures, A, you forget. So there's the amnestic quality.
Right.
B, we're able to work efficiently, smoothly. And then when you go home, the surgery is taken place. Maybe you've had a tooth that was hot and infected and maybe had a hard time getting numb before, but when you're sedated, you're also numb when you leave, but it all together, you're comfortable and you don't remember, and you get home and you get to recover, and the procedure generally goes much more efficiently and quickly, which also results in, on average, less swelling, less tenderness, less post-operative pain. And so the outcome is improved for everyone, and it really is a nice thing to see. Like I say, that one gal I just mentioned, her example is it's always a perfect example to me of how people can somewhat overcome some of that dental anxiety, and they truly can change. And eventually, I know she came in and started doing some fillings and other things without any sedation at all, and she kind of conquered her fears, if you will, which is wonderful. how
No,
nice for that.
That is terrific. Goodness. I have to be self-disclosure here. I'm in my early 60s, so this trend that I hear about dental sedation, it's something that I don't think was available when I was a kid or in high school.
Sure.
And
right.
Can I tell you a funny story?
I'd love it.
I thought I was a real tough guy sitting in Dr. Carter's office in St. Louis, and he wanted to do 2 fillings, and he said, "You want a shot of Novocaine?" And I said, "No, I could do. You just go ahead and fill it. I could take it." Well, when it came time for the second filling, I said, "I want that shot." I was more afraid of the needle. I thought, "Oh, wait a minute, that needle can't be as bad as what I just went through." But
not as that.
But I guess I wanted, and the reason I brought that up is I wanted to talk a little bit about the sedation, and you eloquently explained it just a few minutes ago. But I think it, for folks like myself and my age bracket, and I would imagine that has to be one of the big breakthroughs in dental care, is to be able to have the sedation where you can really, where both the patient and the doctor can work comfortably together.
It's true. It really does make things easier. And I, like you, I had my wisdom teeth out with, they gave me the shots, and I was a big, like you said, tough, teenage boy, like a couple 100 pounds. And, but I remember I must have had a funny look on my face because the oral surgeon said, "Is that painful?" And it didn't hurt, but it was not comfortable because of the pressure and the drilling and the noise and, all the unsettling things that we have. And nowadays I look at our patients that most of them elect like wisdom teeth or multiple tooth extractions. Right. They elect for a little sedation. And to be honest, one poke in the hand or the arm and where an IV goes, and then a little water going in to hydrate you, and then you get some medicine which follows that in, compared to, I think he gave me 8 shots in my mouth, and I felt everything but pain, so it was good. He did a great job. I felt everything but pain. But you have to realize that I felt everything but pain, and that means pressure. That means exquisite pressure. That means, noise, and I could feel the cold water blasting around, drilling, and it could be very unsettling for anyone. It'd be weird if it wasn't unsettling.
Right.
And so now I think it's just to have that opportunity, whether we've gotten to a point in our lives where we're just not interested in putting up with all that, or if we're very young and these little kids, we don't want to start them down that road of that anxiety.
Sure.
The sedation, and we like to keep it very boring and safe, and we try to stay ahead of things, light years ahead of any problems. We just, obviously there's health conditions, which everyone has, and things like that. So we give a good screening and make sure everyone's, again, we shoot for safe and boring. That's what we want our results to be.
I think if I was listening to this podcast, I think one of the questions that I'd want to ask as it relates to the IV sedation is, what is the recovery time? We've all had, I can't say we all had sedation, but if we've gone in for surgery or whatever we've done before, we know there's a process, and sedation does affect people differently. But is there, how could you what could you say to put people at ease about the recovery process from sedation?
Well, the recovery process from sedation is usually very mild. So what happens is you generally have, we tell people don't drive or don't go unicycle riding or legal document signing for 24 hours. Mm-hmm. Now, that being said, most of our patients will feel like they're 100% mentally aware that evening. They'll be like, "Why can't I drive? I feel perfect." But just in case. So kind of medical legally, we tell them, just be wise, because there is there is some residual medication still in your system for another, for the day. And we like people to be watched out for that day. I don't want anyone getting in their car, someone dropping them off. Okay, I'm going to leave. And then they get in their car and go for a joyride. You never know. But they're generally very well. They might have a little dry nose from breathing in a little extra oxygen through the cannula, the little nose ticklers,
Sure.
the extra oxygen that people might breathe through.
Mm-hmm.
So a dry nose, you might have a little, and usually not with my patients. Usually that's with younger kids, but they might have some muscle aches, and that's just a result of some of the medications. But like I said, usually we don't give those to people unless they're more young, like 2, 3, 4, 5-year-olds.
Right.
But otherwise, from what I hear, it's like just being drunk and letting it wear off throughout the day.
Well, the analogy that's come into my mind here, this is something recently, medical procedure I had was a colonoscopy. And
yep.
I from listening to you, my sense is that it's a very similar recovery period, because what you described was similar to what I experienced after my colonoscopy just a couple of months ago. So I'm real big on analogies. I think it really helps us to compare and contrast and get it. So
it's true.
Well, good.
It's very similar. And there is, we actually generally give people a lot of antiemetics or anti-nausea mm-hmm. while they're being sedated as well. So when they're recovering, we try to fight that. It's rare that people even have the postoperative nausea now, and that's a good thing. And we also, people leave numb so that they're not waking up. We of course, while people are sedated and sleepy, we give them local anesthetic, but they don't have to remember. And that's the beauty, is that they get to go home and get their pills, get a little Motrin or some Tylenol or whatever it may be for pain medication. They get ahead of that, and by the time they get home, their face feels a little fluffy and numb still, and that way they can be comfortable mm-hmm. and then take their medications. And then by the time the numbing medication that we gave them during surgery wears off, they'll already be taking their postoperative medications, so they will be comfortable. From the surgery, not the anesthesia won't have any real problems, but the surgery, of course, some surgeries are a little bit more sore than others, so they'll feel that. And, mm-hmm. Unfortunately, they're not always a tickle fight. So I always tell people, stay ahead of it. Stay on top of your medications. Set a timer. That's one big thing. If people do the postoperative instructions as they will, if they follow them on the timer, if you will, then they'll do very well.
Well, goodness, I'm enjoying this 100%. I'm learning, and that's why we do these podcasts on the Whole Care Network, so that people can be informed. And I'm just delighted to be able to talk to a professional like yourself who can explain it in layman's terms and make everybody feel comfortable as they make a choice about what they want to do about their dental health, because it's so important, especially as we age, to have proper hygiene, and it makes such a big difference in our overall health and well-being. So, goodness.
It is. And it's so hard. I mean, you look at our teeth, they're a lot like, if you think about a car driving around, you've got to replace those tires. They just take the wear and tear of your car, mm-hmm. and the tires get worn out. And unfortunately, our teeth, it's a rough environment. They're the hardest substance in the body, and they're clanging against each other all day long, whether we grind our teeth, whether we're just eating and our teeth are, beating against one another, and then food. It is a bacteria-ridden environment, and so to maintain it, we have to, brushing, flossing, things like that. If anything gets left in there, the food creates this acidic environment, which starts to make our teeth demineralize, where cavities start, and then if they keep going, root canals and extractions are needed, or things like that.
I think we've got enough topics to do.
Difficult environment.
I think we have enough topics to do about a dozen podcasts. I think that'd be terrific. So,
yeah.
Well, we've just got a couple of minutes left in our first podcast, Doctor. Can you let all of our listeners know, especially the folks at the Love a Senior Day, how they can find you on the internet, touch base with you? What is all your important contact information?
Okay. You can find us. We're the Pueblo Dental Surgery Center down in Pueblo, Colorado. And so our address is 2041 Pepper Lane. And that's in Pueblo, Colorado, 81005. So 2041 Pepper Lane, like salt and pepper.
2041 Pepper Lane.
If you want,
I like that.
yeah, and if you want to call our office, if that's easier, or you can Google search or Bing search or whatever people do nowadays. You can search Pueblo Dental Surgery Center or just simply call us at 719-696-9009. So,
well, it's just terrific.
And that's 719. Oh, yeah.
It's terrific having you on today, Doctor. And I think on our next podcast, I think another topic that would be very intriguing for all of our seniors, especially at the Love of Senior Day, was I guess there's no way else to say. Let's talk about implants and wisdom teeth and extractions. Yep. Those are topics that just it really just needs to be talked about honestly. And I think you're certainly the one to be able to give us all the pertinent information so that we can make great choices for ourselves.
Sounds great.
Okay. Well, Dr. Baer, with the great work that you're doing in Pueblo, you're certainly someone who's creating healing ties all around us. I can't thank you enough for joining me today.
Thank you. Thank you very much.
Okay, well, that does it for this episode of Healing Ties. As you know, I'm your host, Chris McClellan, the Bowtie Guy. I'm creating a life to love after caregiving ends through radio, writing, travel, advocacy, and being with awesome people like Dr. David Baer. Healing Ties is a part of the Whole Care Network. Check us out online at thewholecarenetwork.com, where you can see all of our show hosts, learn about all of our podcasts, especially our special podcast featuring Love a Senior Day with Dr. David Baer. We'll see you for another episode of Healing Ties real soon. Bye-bye.
Thank you.